Over and over, you've heard about the so-called Louisiana Purchase. Is Senator Mary Landrieu being hammered fairly or unfairly? We report you decide. Louisiana Senator Mary Landrieu goes on the record. The so-called Louisiana Purchase, I take it you don't use that reference to the provision in the health care reform bill that benefits.
Absolutely not.
You don't like that? You don't like that?
Well, not only do I not like it, but it's really a mischaracterization of what happened.
Okay, what happened?
It's not a special deal for me. It's a fair deal for the people of Louisiana. I'll tell you what happened. The levees broke, and a hurricane hit, and the levees broke, and our personal income went up 40%. Not down, but up 40%.
Personal income.
Personal income went up, according to the federal government, 40%. It's never happened in the history of the country, and it's false, and it's not right.
Why
and so
did it go
I had
up?
to adjust because all the extra money that poured into the state, and so the federal government claims that we're 40% richer. It's laughable, it's a joke, and so we fixed it. Did not fix it secretly. John McCain continues to say that it was secret because he didn't know about it. Just because it's unknown to him doesn't mean it's secret.
All right, explain to me. You say that the income went up 40%. Was that like a one-time deal? And how does the income go up? Is it because of all the jobs? Because I know that your unemployment is about 2% points below the national average. I mean, I don't understand how the income goes up is a reason to get something in this bill.
Because when the income goes up by 40%, our Medicaid reimbursement drops. And the income that was raised by 40% was not because we had 40% more business or 40% of the people were really richer. It's just because of the insurance money that poured in, the federal funding that poured in, and it arbitrarily and artificially increased our per capita income. It's happened in Hawaii as well. So I publicly announced 2 weeks before Barack Obama got sworn in, and a year ago, publicly announced that we were going to fix this. And the governor and I, my Republican governor, stood with me at a public news conference and explained why we needed it fixed, and we've attempted to get it fixed. We make no apologies for it, and it wasn't a special deal.
All right, 40% income, though, is it like every single person has an increase 40%? Because now all of a sudden that sounds like a better deal than before. I mean, people. It sounds like you're saying people are 40% richer, so now I think, well, then now why do you need this money? Explain it to me.
Okay, let me try.
You may have a hard time.
I don't believe and know that the people of our state are not 40% richer. That's the deal. The federal government is saying we are. It's a joke.
So you are not 40% richer?
The federal government is saying we are. I mean, according to the federal government formula, we are 40% richer. That is why the governor and I stood shoulder to shoulder to tell the federal government that is incorrect. We are not 40% richer, and we tried to change the law so that we could continue to pay the same amount for Medicaid that we've paid for the last 10 years.
So this doesn't change your contribution at all? It's an arbitrary matrix? Is that what you're saying? That suggests you have
You're exactly. That's why we've been unfairly criticized for this. We have always paid in Louisiana 70 cents on every dollar for Medicaid, and the federal government's paid 30. We want to continue to do that. But if we wouldn't have changed this provision, which I champion, and I'm proud to champion, we would have ended up having to pay 60%, and the federal government would have paid 40, or the reverse. We would have ended up paying more, in other words.
All right. Well, I've looked at some numbers. Your unemployment level in December is about 2.2% lower than the national average, which is good. Which is good. And I also noticed that your foreclosure rate is lower than most states, which is good. Which suggests to me that the economy in Louisiana is on an upward trend. And so that's why I wonder why this other number, this 40%, why you need this help.
Well, our foreclosure rate is lower, but that's because we have 60,000 blighted homes in the city of New Orleans and surrounding areas. I mean, our foreclosure rate is lower because we didn't get foreclosed on by the credit crunch. We got foreclosed on by a flood.
And that's not counted?
And that's not counted.
Number? Okay.
Yeah, so foreclosures don't really mean anything to us because we got foreclosed on by the storm. So the bottom line is we never asked for a special provision. We never did it secretly. It was done in a bipartisan way. Our legislature passed a public resolution. Our governor signed a letter asking us to fix it, and I did. And the fix is only that Louisiana will continue to pay the same amount we have been paying for the last 10 years.
So without this, and if the Senate health care bill passed and became law, your state would take a dive financially
Well,
unlike other states?
Our state would have paid more for Medicaid
than it would have before.
And what I'm saying is it's not fair to ask us to pay more because the people in our state aren't actually 40% richer. The numbers say we are, but if you ask anybody in Louisiana, we didn't get richer after the storms. We either stayed the same or got poorer.
Right,
people have lost hundreds of thousands of dollars.
All right, so you pay the same amount before and after the Senate bill. Okay, so
and
that's
after the Senate bill, that's right.
All right. Would it have been wiser, smarter, perhaps, to have had this fix or whatever? I don't know how to describe it. Would it be better to have this run separately and not part of the Senate bill? Politically smarter, not for you personally, but for getting this whole health care bill passed.
No, I don't think so, and I'll tell you why. Even though some people want to criticize it because A, they don't understand it, and they won't take the time to understand it, and they're just sort of using it for their own political purposes, to tell me that I should not put on a health care amendment on a health care bill is kind of a joke.
Well, then, then are you not in favor? If you think that should be included in because it's a health care bill, should it not be included into the health care cost, the doctor fix of $250–350 billion that's on the side in terms of trying to figure out what the cost is? Shouldn't that be in the health care bill?
Well, it could be, but you know,
should be.
It could be, but I mean, the health care bill. There should be amendments to a health care bill. This is an amendment to a health care bill, which again was announced 2 weeks before Obama was ever sworn in as president, was announced in 3 separate press conferences with myself and the governor, passed a resolution by our legislature. Again, it might have been unknown to a few senators, but just because it was unknown to them doesn't mean it was secret. It was done in a very public way. I've given many speeches on it. I'm quite proud of asking for this to be changed because if it wasn't, the people of Louisiana would unfairly have to pay about $350 to $400 million more for the same Medicaid program.
The deal that Nebraska got, and I'm very reluctant to call it the Cornhusker deal because I think sometimes we're rather flippant and sometimes can be insulting to people, but what's your thought on what Senator Ben Nelson secured for his state? Because it has caused a lot of upheaval and a lot of people are unhappy about it.
Well, I think Senator Nelson has to speak for himself on
I know, but what do you think
issue.
about it?
But you know,
is it different?
It is different. It's different in the sense that our provision for Louisiana was caused by the storm, by the flood. It wasn't caused because I was trying to, you know, jockey my vote for the bill. It was caused because of a storm. And the provision that we put in for Louisiana, a public effort, will also help the state of Hawaii because for some reason the state of Hawaii had some kind of catastrophic disaster and their income arbitrarily went up. So my amendment was never fashioned just to help Louisiana.
More with Senator Mary Landrieu on whether we can afford the health care bill. One of the things that has caught my attention, caught many people's attention, is the fact that the way we pay for it, the Cadillac tax, and it starts going into effect in 2018 in order to finance this bill. It appears from the outside that, you know, if this is a good idea, this tax, if we need to pay for this, maybe we should do it now. Instead, the Democratic Party pushes it off to 2018 when even if President Obama serves a second term, he'll be long gone.
And you know what? I agree with you because I supported that tax going into effect now. I think it's one of the most important things that we can do to get the cost of health care down. The moderate Democrats feel very strongly about it, but you know what? We don't control the votes around here. We have a say, we have an influence.
You pretty much control them. You may not control the content, but
we like
the agenda.
But we push very hard for that on our side. But you know, this is a democracy. It's not a dictatorship. So there are lots of people that have views. And, you know, I wish we could have done that a little differently, but that's the way it came out. One
of the things that's not included is the so-called doctor fix, which is $250 to $350 billion, depending on who gives you the number. That is being excluded from the number. Would it not be the right thing to do to include it in the number so the American people can see truly what this is going to cost? They may think it's a good idea or a bad idea, not saying whether if Dr. Fix is a good idea or bad, but why not put it in the number?
Well, I'll tell you why not. Even though technically it would probably be, according to the book, the thing to do. If we put that $300 billion in, we have to take $300 billion of something else out. And what's going to come out is help for the elderly. Because of the school. Because if there's a cap.
Maybe we should change the cap.
Well, maybe we should, but then the bill gets quite large and it's very difficult to pay for.
It's hard to sell it.
No, it's not hard. You either have to raise that number, you have to either raise that in additional taxes or cut services to either the elderly who are trying to get help with their prescription drugs or eliminate preventive care, and it's not necessary because technically those cuts aren't even going to happen. I mean,
but explain to me. I'm simply, and I'm sorry for being ignorant, but I don't understand how if we're going to have to pay this number anyway, the Dr. Fix.
But you're not going to pay it.
We're not
going to pay it.
We're not paying the Dr. Fix?
No, because we say, this is what we did a couple of years ago, and I really wasn't here, I don't think, when this started, but I think I know a little about it. We said that to save money in health care, we're going to cut doctors and hospitals 10% every year. We've never implemented that. We've never implemented it.
We've never cut the doctors?
We've never cut them, I don't think, regularly 10 or 20% every year because it's unsustainable. That's the way we used to fix health care. We just cut hospitals and doctors. That's not right. We don't need to cut hospitals and doctors. We need to change the system, and that's what this health care bill attempts to do. Change the incentive. So everyone is trying their best to deliver better quality health care for lower cost so we don't have to keep cutting hospitals and doctors again.
So you're telling me that if we do this health care bill according to the Democratic plan, that this so-called Dr. Fix will be irrelevant because doctors won't need to be fixed? Is that what you're saying?
Because doctors shouldn't be cut. Because doctors shouldn't be cut. Because the cost of health care will come down because of streamlining processes that we've put in.
The Republicans tell me that they are in favor of, of a low-cost health insurance for people who, for people with pre-existing problems. What the Republicans tell me is that they just believe, rather than doing this sort of huge revision or a huge overhaul, is that we do it step by step so that essentially we can see where we are and what's happening along the way. They say they are not opposed to it. They say that your party is unwilling to listen to it and want to just use your power and do as you
Well, what I would say are two things. One, when they were in power, they didn't do it. When they were in power, they didn't spend 2 weeks on health care. All they did was give tax cuts to people that make over $1 million. That's what they spent all their time talking about. Number two, Barack Obama won this election, John McCain didn't, and there are consequences of winning. Democrats promised the people of this country that we would provide for them the same or similar insurance that the members of Congress have, and that's what we're doing.
But he also promised transparency and no special deals, and we get the special deal to the pharmaceutical industry last June behind closed doors at the White House, and then we have the deal with Nebraska. I understand Louisiana. We have the deal with Nebraska, which is a special interest in the state of Nebraska to get Senator Ben Nelson's vote, and then we have the union deal in early January. So it's not quite, he may have won the election and he's delivering on his promise, but there are other sort of subsets promises which many people relied upon is how we were going to achieve these goals.
And let me say those are disappointing aspects, and you've pointed out 3 that are disappointing, but you know what? The union deal is out. The Nebraska deal has been pushed to everyone, and the Louisiana deal has been fully explained, and it will stand the light of day.
But it would have been in but for the Republicans raising hell, and when they were raising hell, they were suddenly called the party of no by the Democrats because they were objecting to that which was promised.
We called them the party of no way before because they said no many, many times before Nebraska.
Maybe no plus.
But you know what? We need to get through, I think, this health care piece as soon as we can and get on. Now, this will be a jobs creator as well, but we really need to get on to an energy and jobs creation bill, and I'm excited about that. And I think both parties made a lot of mistakes in the health care debate. I don't want to see us make the same mistake in the energy debate. We have such an exciting opportunity, and I hope that we can do it in a bipartisan way.
Well, there's so much more of our interview with Senator Landrieu, and guess where you can see it? Tomorrow, entire interview on Greta Wire.